This is a short video about breath-holding attacks. Very common in the terrible twos, what pediatricians describe toddlers, around the age of 2. They, number 1, won't eat. Number 2, they won't go to bed. Number 3, when they do go to bed, they won't go to sleep. And number 4, even at the most occasionally extreme limits, they won't breathe, although that seems incredible when breathing is so essential for all of us. It's partly the transition from being a baby to starting to be an independent young child. It's expressing their own determination to get their way, and amazingly breath holding is one of those. So we distinguish these breath holding episodes into 2, blue ones and white ones, and the blue ones really are breath holding. Typically can start as young as 6 months, can go on as long as the age of 4, but typically around the terrible 2s. What is a blue breath holding attack? Well, they're always preceded by, it's essentially a super temper tantrum. There's an episode leading to anger or emotion. The child gets really upset, starts to cry, cries, in a sort of paroxysm, crying, and then holds their breath. And then they go blue in the face. And then if they carry on, they'll lose consciousness and they'll fall down to the floor. And very rarely, they may actually have a brief convulsion, a few jerks of their limbs. It's not epilepsy, don't worry, it's not epilepsy. It doesn't lead to epilepsy. But because they're holding their breath and going blue, and the reason they fall down is they're starving themselves, starving the brain of oxygen, there may be a few jerks of a convulsion. What can you do to stop this? Well, it's really difficult. I mean, ideally don't have episodes that lead to tantrums. Easier said than done with a 2-year-old. You can try distraction. If you're a very outgoing extrovert person, funny, you can make faces, tell them about something that will try and get them out of the tantrum, but it's really difficult. As with all the terrible 2s, general advice is we ignore unwanted behaviours and reward good behaviours. So you can be very positive and reward them if the child does stop. If they do carry on, lose consciousness, ignore it, not to be punished. And the good news is the outcome's excellent. These children stop by the age of 4 and it has no long-term consequences. The other episodes are called white attacks as opposed to blue attacks, and they're actually not really a breath holding, although they're often thought of together. They're the equivalent of a faint in an older child, teenager or adult. So what triggers these is a bump often to the head, something painful, a fall, or something very frightening. And they are much more sudden in onset than the blue attack. You probably not notice that the child's, you wouldn't think they're holding their breath, just this event happens, it hurts them, they might cry briefly or scream out, and the next thing is they're looking pale or white, and then they may collapse to the ground. And if you're a first aid trained person, you may notice they have a very weak pulse, so you can't even feel their pulse. Because it's like a faint. The heart may slow down. They look very pale because the blood's not flowing to the skin and it's not flowing to the brain very much, which is why they lose consciousness. And again, some seizure or jerking may briefly follow, but again, it's not epilepsy. Again, it has an outcome which is excellent. There's no long-term problems. There is no magic treatment. The treatment is, as with a faint, they terminate themselves. When the child falls to the ground, gravity restores the blood flow to the brain and they wake up, and unlike with an epileptic fit, a seizure, they're perfectly well immediately afterwards. They don't have a period of drowsiness or bedwetting or tongue biting, which you might have after a truly epileptic seizure. So, in summary, we see, not uncommonly in young infants, blue breath holding attacks and white attacks, sometimes called a reflex anoxic seizure, if you're reading about them on the internet. And both of them can be very frightening, but both of them have an absolutely excellent long-term outcome. And whilst they're a cause of great concern at the time, you don't need to worry about any long-term problems with your child. Thank you for listening. Take care. Goodbye.